everybody. Welcome. As the introduction, I am Dr. Maciolek. I'm a clinical psychologist. And about, 3 years ago, I thought it was a good idea to start a group practice. Shortly thereafter, I had had triplets. So I don't know why I thought that was a great idea. I wanted to challenge myself, I guess. And the center, we have psychotherapy, med management, and a variety of other holistic treatments like acupuncture, nutrition, massage, yoga, and really wanted to try to have a holistic perspective on helping all of us heal however we best need to. So today we'll be talking about mindfulness and some other things that can help secondary effects of some autoimmune disorders and pain management. So as many of us know, human nervous system, central nervous system, peripheral, and sensory and motor. And today we're going to be focusing on, of course, the automatic and parasympathetic and sympathetic nervous system, specifically sympathetic, and ways that we can decrease and learn to navigate the sympathetic system that can get aroused through things such as, go to the next one. So the sympathetic is our on switch. Who's heard of fight, flight, or freeze response? So probably pretty much everybody. And then our parasympathetic is our off switch, where we rest and digest. So the sympathetic nervous system being the on switch and pre-programmed in our bodies for danger, for acute stress responses. So many of us may have felt a sense of danger where immediately we have we freeze, or we have shortness of breath, increased heart rate, chest pain, blood flow away from digestion, sweaty palms, shakiness. Sometimes this can lead to panic attacks and things that people feel like they may be having a heart attack, need to go to the hospital for that. Many times, though, this can be something that's occurring along with something like, for instance, a while ago I was diagnosed with Graves' disease, so I thought that I was actually having anxiety. Really, it was not anxiety. It was more of a secondary effects through something that I was experiencing primarily as my autoimmune disorder. So many times with the sympathetic system, we can feel as if it's turned on, and it may not be necessarily due to a real threat or even an anxiety disorder, but really can be something coming from a physiological. So whenever I see a client or a patient, I always make sure that they've gotten all other diagnoses that could be physiological ruled out before I'm comfortable saying it has to do with just strictly a mental health condition. So I liked this because I was trying to describe to my 5 and 5-year-olds and 8-year-olds what sympathetic and parasympathetic was. So this was a good descriptor of every kind of aspect of our bodies. And so I thought I would put that up there so we would have access to that. Again, dilates pupils, inhibits salivation, bronchial dilation, digestion, etc. And then on the other side with parasympathetic, constricts pupils, gives us the sense of calm, happiness for an emotion, relaxes everything. So psychological symptoms that's comorbid with dysautonomia. We can experience stress, tension, anxiety, depression, feelings of helplessness and hopelessness, which doesn't necessarily mean that we have depression, but more along the lines of feeling hopeless and helpless, that things are not going to get better or things may not be changing. Sleep disturbances, fatigue, cognitive issues. And as we were talking about with the sympathetic nervous system, the stress and anxiety will elevate cortisol levels in our body, which is not a good thing. We don't want them. It increases the stress hormone, which taxes adrenal glands, lowers immunity, decreases digestive functionings, fatigue, and affecting our blood pressure. And we want to try to take steps to reduce that. I'm going to go back to cognitive issues for the next slide. So when we experience cognitive issues, if you can go to the next one. Yeah, no. Specifically, I was giving the example in POTS. So brain fog, word recall issues, fuzziness, difficulty thinking, trouble remembering, concentration issues. And so sometimes people will present in a psychotherapy session with these things. And so the next slide is in regards, I had a case study where a 16-year-old female, we'll call her JR, came into therapy with her mom. And she looked to appear to have a learning disability from a previous educational assessment from school. Reading disability, concentration anxiety, feelings of hopelessness, light sensitivity, irregular heartbeat, feeling on edge, sleeping problems, cyclical vomiting, chronic fatigue, and constipation. And so she had been through a myriad of different therapists. No one really knew what was going on with her. She had not yet had any diagnosis of dysautonomia or anything else. So we had talked about getting in to see the cardiologist, getting in to see a GI doctor. They did finally diagnose her with that. But at least in our work together, worked closely with all of her other doctors to treat in regards to utilizing CBT, which is cognitive behavioral therapy, and utilizing mindfulness therapy. And that was helping her to decrease her symptoms. She was less anxious, was able to sleep a little bit better, more relaxed and less stressed out in general, which is a good thing. So mindfulness, what is it? Somebody said that it was a good thing. Have you all heard of it and or utilized it before for yourselves? Okay. So basically it's just a way of learning to relate directly to whatever is happening in our lives, a way of taking charge of our life, a way of consciously and systematically working with our own stress, pain, illnesses, and the challenges and demands of everyday life. So it's also a way of being present-focused, non-judgmental, and being in the moment, being an observer of what we're experiencing with our symptoms. And John Kabat-Zinn, 1979, had founded that. So how can mindfulness help? Specifically, I utilize mindfulness-based stress reduction, MBSR. Like I said, 79, he had started utilizing this to help patients with stress, sleep problems, anxiety, and high blood pressure. And originally, it was created to help with chronic pain patients. Connections to symptoms. So the idea of being mindful in pain seems to be counterintuitive. People want to forget about pain. I know I do. Want to escape it, run away from it, wishing you could ignore it and get rid of it somehow. So ironically, that by fighting and struggling against that, it causes more stress and tension, and therefore you can focus and hyper-focus more on it, and that can in turn create and cause more pain. So mindfulness-based stress reduction is an 8-week, very structured program. It is evidence-based. They've done a ton of research on it. And it provides the mindfulness meditation training, which I'm going to do an example at the very end for those of you that want to participate. It helps with reducing stress, anxiety, depression, and learning new ways to cope with pain. Providing an increased awareness and focus and concentration, which if you've all or anybody has experienced brain fog, which I know I have, this definitely can help with that. Stress reduction experts recommend that the body scan, which is the one we're going to be doing at the end, is the best one to utilize for pain conditions. So other forms of holistic wellness support, like I had said, I have tried to put these into the center that we run to try to help in a variety of different ways. So with psychotherapy, I had mentioned CBT, cognitive behavioral therapy, where you try to address negative thoughts or negative cognitions that are connected to our behavior and therefore the response that we have. We can utilize that for our self-esteem, relational, defining our identities, and altering patterns, as I stated, of negative and distorted thoughts, catastrophizing, things such as that we might all do. Family and marital therapy is helpful. Use that a lot, even if someone's coming in for an individual issue. Usually somebody is called like the identified patient. Typically, though, there's a family system or other things that are happening where that individual or the one coming in could be better supported with other family members involved. And especially in working with children, I found that the child is the one that usually doesn't need to be there, but usually it's the parents. And so when my kids are acting out, I say, I need to actually go in and get help, not you guys, because they're feeding off of whatever my anxieties or stress are. Strength-based therapy, I utilize this a lot, as I said, in my work. A lot of patients that I see are either Medicaid or Medicare, maybe have a lot of issues with connecting to resources, in need of financial support, etc. And so I really like to focus on strengths in a client, not necessarily what they don't have, but what they have, and then utilizing what they have to support in other ways. And interpersonal therapy, and the relationships and the connections that we have within families or communities. Restorative yoga helps with relaxation healing for patients with muscle tightness and chronic pain. And acupuncture, I don't know if many of you have tried acupuncture before. Any positive things you've gotten from it? Good. Research is mixed on it. We do have it at the center, but for some, they don't find any benefit. For others, it can really help with headaches, sleep, and any endocrine disorders. Massage helps with circulation, experiencing chronic pain, joint pain, muscle spasms, or migraines. And then nutritional counseling can be helpful for GI issues, tracking food intake, and proper nutrition. So, the body scan exercise, which I didn't know how long it would take, so I wanted to make sure we had enough time. For those that want to participate, feel free to. For those that don't want to, you can stare at me closing my eyes if I am and make fun of me. But basically, I really wanted to do almost like a guided exercise so you all could take this and utilize it at home. Has anyone done this before? Has it been helpful? Okay.
So using your 5 senses.
Very good. And there's a variety of different of other things that I would teach, such as guided imagery. For instance, with guided imagery, thinking of a place that is calming and relaxing, utilizing your 5 senses to imagine yourself in that place. And something where I use for grounding exercises, where you can do this wherever. We're sitting in this room. You would take a minute to notice what sounds you hear. Do you have a taste or anything in your mouth that you're tasting? Something that you're feeling. So using your 5 senses to really ground yourself in the here and the now and the present. And that can really help if we're experiencing any feelings of anxiety or we feel like we really need to take our mind off of something. It's a good distraction. So today will be the body scan. I was going to play some music from my phone, but I don't know how that's going to go, so I'm going to cut that part out. Although the music that I usually force my patients to listen to, it's called Weightless, and I don't know if I think there was somebody presenting on music, and she may have talked about some, basically neurosurgeons and neurologists have found that the Weightless song, for whatever reason, neuroscientists, that this is very calming neurologically to our body. So that's what I was going to hear, but it's on my phone. I didn't get it connected to the...
So what I'm going to have you all do is if you can get
let me see it.
Position as comfortable as these chairs are.
Yeah.
I'm not sure.
Okay. Let's see.
If you feel comfortable closing your eyes, feel free. If not, focus on one aspect perhaps of the room.
Yeah, no, I can turn the volume down too.
And we're going to start with some belly breathing. So
don't listen to this while
what that is. If you put your hand on your stomach.
And actually it states it in like
when we take a deep breath in.
Therefore people are falling asleep while in the car. Or yes, or anything that we're... So what I'm going to have you all do is if you can get into a comfortable position as comfortable as these chairs are. I'm not sure. If you feel comfortable closing your eyes, feel free. If not, focus on one aspect perhaps of the room that you can divert your attention and just look at.
Take 2 more deep breaths like this.
And we're going to start with some belly breathing. So for those of you that know what that is, if you put your hand on your stomach, when we take a deep breath in, expand your stomach like
each breath that you take,
and see if you can get in as much oxygen as possible. Hold that for a few seconds. And as you exhale,
notice now, starting with your head,
deflating like a balloon, and letting out as much oxygen as you can. We're going to take 2 more deep breaths like this.
Your jaw.
Deep breath in.
Your temples.
Expanding your stomach as comfortable as that is.
What sensations are you feeling?
With each breath that you take, trying to feel your body becoming a little bit more relaxed.
Sharp, dull. And
I'd like you to notice now, starting with your head, where any tension lies, and bringing awareness to it. Your forehead, your jaw, your temples. What sensations are you feeling? Any tightness or pressure? pain, sharp, dull. And I'd like you to just observe the sensations. Be curious about it as if it's separate from you.
On any tightness that you're having.
As you're focusing on your head, continue
So like to envision a white light
with each deep
or
breath,
a healing light on any part of their body that feels tense.
trying to let out any tension,
And as you take a deep breath in,
any pain or pressure
imagine
you're
that light
feeling.
intensifying on that body part. And then as you
Move at your
exhale,
own pace,
exhale that light out.
from your head down to your neck, to your shoulders, and focusing
Moving from
on
our
any
shoulders
tightness that you're having.
down to our chest.
Some like to envision a white light or a healing light on any part of their body that feels tense. And as you take a deep breath in, imagine that light intensifying on that body part. And then as you exhale, exhale that light out.
Any sensations that you're having there.
Moving from our shoulders down to our chest.
And exhale.
Again, noticing any tension that you're having, any pressure or pain, and just observing it.
Down to our stomachs.
From your shoulders to your chest, focus on your upper arms.
Anything you may notice there, just observe as it's a part of you. That's
Any
something.
sensations that you're having there. Breathe in
Focusing on your breath
and exhale.
your body.
Your body should be feeling more calm.
To our lower body, our buttocks, our upper legs.
Breathing out any tension or stress or anxiety you might be feeling. Down to our stomachs.
Non-judgmental to ourselves, just notice the pain you're feeling.
Anything you might notice there, just observe as it's a part of you, but separate.
Into our calf and
Focusing on your breath and that body part as you move through your
feet.
body.
Sensations are there as we focus our attention and release through our breath.
Into our lower body, our buttocks, our upper legs, knees, any pain that you feel, tightness.
And now anywhere that you felt the most tension or the most pain.
Remembering to be kind and non-judgmental to ourselves, just notice the pain you're feeling and release through our breath.
And consciously try to relax that body part as we're breathing.
Into our calf
Focus
and
on
feet.
this one part, and we're going to do 5 more deep breaths together.
The sensations are there as we focus our attention and release through our breath.
And exhale.
And now anywhere that you felt the most tension or the most pain in our bodies, go back to that one location
Bring in as much oxygen as you can.
and consciously try to relax that body part as we're breathing. We're going to focus on this one part and we're going to do 5 more deep breaths together.
2 more deep breaths.
Deep breath in
We're going to bring our awareness back to the room in 5,
and exhale.
4, 3, remembering to stay calm.
Another deep breath,
Let go of any tension.
bringing in as much oxygen as you can, feeling more calm, less tightness. 2 more deep breaths. And we're going to bring our awareness back to the room in 5, 4, 3, remembering to stay calm and we've let go of any tensions that we're having in 3, 2, and 1. Whenever you're ready, feel free to open your eyes if they were closed.
Now this is something that I share with people to practice. It's like years ago, riding a bike, any of those things where we
So
really
question for you guys. I'll lower this a little bit. Did anybody notice, I should have remembered to ask before we started, how we were feeling? Usually I'll have clients kind of provide me with a number of where they feel pain perhaps and a pain scale. Did anybody notice a specific part of their body that felt more pain than others? Afterwards, did you notice a shift at all? Okay. Now this is something that I share with people to practice. It's like a new skill, riding a bike, any of those things where we really have to get into the habit of doing it. I usually recommend trying to do it once a day if possible, more if you'd like to. But it's a skill that we really build on. And it's something that, along with the diaphragmatic breathing, where we allow our diaphragm of our bodies to relax to get in more oxygen, can really help to calm us down. It helps to give us a little bit less anxiety, which I'm sure we all could use in this day and age. And it's something that can be done whenever. I usually, again, have people practice minimally once a day. Same thing with the body scans or any of the guided imagery. The utilization of the grounding techniques where you focus on the environment. Usually we all have one or two senses that we feel more connected to. So if we think of the five senses, is there one that anyone would share that they're kind of most connected to? So like listening or is music calming for you, or perhaps you really enjoy like touching something calming or soft like a blanket, looking and using our visual sensations. Anyone feel comfortable sharing what for them they feel most connected to?
For me, it's smell. So I can smell like very bad triggers. Sometimes around me, but on the flip side, I love the smell of colors. So I get everything.
Yeah.
So it really like calms me down after being outside.
Yeah, absolutely. Yep. Candles and all of this, yeah. And essential oils are really important too. We like to really use lavender as a very calming one, so that's a really great example. Okay. That's good. It's good to know what we prefer.
Say we have a running dialogue where we're feeling overwhelmed or stressed out.
What colors would you say?
Senses can really distract us
Okay.
and take us from wherever we are internally to something physical.
Do you associate aqua to something in?
So again, I have people practice. They don't know automatically what to do. I'll do which one they more I always say to practice realizing all five, see where they lie, and then that's kind of our go-to. So I will do it when my children are fighting, and I'm going to take my hair out and hiding in the closet.
When we utilize our minds to consciously shift from, say, we have a running dialogue or we're feeling overwhelmed or stressed out, being able to focus on one of the senses can really distract us and take us from wherever we are internally to something physically that's happening in the here and the now. So again, I have people practice if they don't know automatically like you all do which one they more gravitate to. I always say to practice utilizing all five, see where they lie, and then that's kind of our go-to. So I will do it when my children are fighting and I feel like I'm going to pull my hair out, and hiding in the closet doesn't work. So I will usually find some, even if I have to like wear earphones and like listen to something temporarily just to like calm down. So there's lots of techniques that we can do to kind of distract ourselves and keep us in that place. Anybody else wanted to share about how this meditation or mindfulness experience just was for them?
I think I saw it in a photograph, so that's where I go to. And so putting ourselves in a place where we're able to really be feeling safe, feeling like we're able to, again, put our five senses into it. We're going to hear, taste, touch, feel, and experience and not limit.
So the example of using the five senses is a really good one because it has nothing to do with the breath. The guided imagery I like as well because we don't have to do the diaphragmatic breathing. When we close our eyes, for instance, and really connected for whatever reason to a specific place in Hawaii that I've never been, but I think I saw it in a photograph, so that's where I go to. And so putting ourselves in a place where we're able to really be feeling safe, feeling like we're able to, again, put our five senses into it. What would what I hear, taste, touch, feel, and experience in that moment can take us out of whatever presently we're in into something that feels safe for us. But you don't have to do the diaphragmatic breathing for that either.
I've heard a lot of people say that, and I didn't necessarily want to do that.
You can do that too without doing the breath. I think just scanning the body and noticing where we're experiencing the pain can work without the diaphragmatic breathing as well.
Maybe for whatever reason that the physical then is not making it levels for you, and they're finding it alternative. So yeah, I was gonna say progressive usually would work for for you.
Yeah. I didn't want to, and that's a good point because I've heard a lot of people say that, and I didn't necessarily want to do that because of certain pain triggers, but you can do what's called progressive muscle relaxation, and you've tried that and that doesn't work for you either. It may be for whatever reason that the physical then is not where it lies for you, and finding alternative ways. So yeah, I was going to say progressive usually would work for tightening and relaxing, but for you, yeah.
Let me ask you this. If you fall asleep doing it, short of easier where you wouldn't want to be sleeping or in would that be a bad thing?
If I'm at home, no. If there's some like family situations, like trying to
Asleep.
where I need to you're focused out, trying to get back to how do I do that? Then you want to come out either as a groggy
Let me ask you this. If you fall asleep doing it, short of being somewhere where you don't want to be sleeping or you don't feel comfortable sleeping, would that be a bad thing?
If I'm at home, no. If there's some like family situations where you don't have time to
more more aware of what's going on situationally, but at least you're focused on something where whatever the stressors are, perhaps leaving, if it's with family and you want some space while you go outside. Walking meditations are really good. People are able to do it takes some practice.
Then no, especially at work when I try to do things between patients, and the last thing I want to do is to be groggy or fall asleep and be late for my next session. So that's a very good question. I think that's when I would come back to doing certain grounding exercises where you don't have to close your eyes and you're more alert and more aware of what's going on situationally, but at least you're focused on something where whatever the stressors are, perhaps leaving, if it's with family and you want some space, walk out and then go outside. Walking meditations are really good. People are able to do, it takes some practice, but with eating meditations too, where you're very mindful when you're putting the food in your mouth, noticing the texture, noticing what it tastes like, noticing when you swallow, how it feels going down your throat. There are certain things that we can do that are more of the awareness piece and less of closing our eyes and doing the breathing that's relaxing that way. So I would probably focus on those.
Again, it's trying to find what tools work for each of our toolboxes. So we're all very different.
Yep.
Might help one, may not help somebody else. So
Thank you for that. That's an excellent. Yep.
Practicing those things or those whatever.
We'll call it movement meditation. Yes. Thank you for that. Yes. Or swimming. Yeah. Yes. Yeah. Yeah. Don't go with kids. No, but those things can be, again, it's trying to find what tools work for each of our toolboxes. So we're all very different. What might help one may not help somebody else. So just really figuring out what works for you, practicing those few things or those plethora of whatever works, and really honing that skill and practicing it daily if possible. Thank you.
We're actually going to do a panel.